Hi, everyone. Thanks for, I think we're going to get started. And as folks start to funnel in, just so that you know, this talk is going to be recorded and we're live right now on Facebook. And we will send out the recording and some notes after the thyroid talk. So Dr. Tabar will send it up. And yeah, so I wanted to introduce our facilitator for today and our lecturer, I guess. So Dr. Tania Tabar we're very lucky to have her. She's the co-founder of Aurum Medicine Wellness Clinic and owner. She is a naturopathic doctor here in Toronto, Ontario, in Canada. And she started practicing in Sheffield, England, and then moved back here to Toronto to continue her practice and grow. And she works a lot with folks with hormone conditions. I don't know if some of you saw her post or not on Facebook, but definitely follow her on Facebook. Her Facebook page is Dr. Tania Tabar. And she has a wealth of knowledge in hormone conditions. So anytime I have a patient with hormone problems or potentially something to do with the thyroid, I always ask Dr. Tabar. I say, is this formula good? Like, what should I be looking at? What's the current research? So I'm really excited for today's talk myself as well. And in terms of her background, she's a graduate of the Canadian College of Naturopathic Medicine, and she's a member of the College of Naturopaths of Ontario. She was also a member of the General Council and Register of Naturopaths in the United Kingdom. Prior to CCNM, she completed her undergraduate studies in political science and journalism at Concordia University in Montreal. She worked as a writer, editor, and youth facilitator. And during her clinical years at CCNM, she did placements at the Brampton Naturopathic Teaching Clinic at Brampton Civic Hospital. She did 4 month-long placements at Anishinaabe Health Center, and that was working with folks from the Indigenous communities. And she also worked at Sherburne Health Center, working with patients who are HIV positive. In her spare time, she likes coffee and walking by the water and reading at the park. And we're super, super happy and looking forward to your talk, Dr. Tabar. So welcome.
Thank you, Dr. Huang. Thank you so much. So this is going to be the question we're answering today. Is my thyroid imbalance? I want to start with a story. I'm really excited to be here and to do this talk. And every person has a unique health story. So I'm going to take a bit of time to share mine. As I was preparing for this talk, I actually decided to look through all of my medical history. So from 4 or 5 years old to the present. And as I was kind of going back to when I was a teenager, I realized that when I was 13 years old, I went to see my family doctor at the time and for fatigue and difficulty sleeping. And I looked at my lab results that were run, and I realized that my thyroid hormone, my TSH, which we'll learn more about, was on the lower end. So it was under functioning and out of balance. I didn't receive any treatment options or investigations at the time. And then my next lab result that I saw was 5 years later, and that drastically shifted to a high TSH, so under functioning and out of balance. And I think 2 years later, I was referred to an endocrinologist, and again, I wasn't offered treatment or further investigation. It wasn't until actually 2015, 16 years after my initial abnormal result, that a different family doctor at the time decided to do a full thyroid panel, and I was actually diagnosed with Hashimotos thyroiditis. My antibodies, and we'll learn more about that, were elevated, and I had nodules on my thyroid. Thankfully, cancer was ruled out. But again, I was not given treatment because my TSH and thyroid levels were within what is considered normal range. Now, my doctor at the time, the one who diagnosed me, was actually an excellent doctor. She was thorough, she listened. I have a lot of respect for her, and I really appreciate that she diagnosed me. So I understand that it's not that she didn't want to do more, but it's just the extent of the tools that she has. After that, I I was lucky because I was in naturopathic medical school. I was in my 4th year, so I had some time to research what was going on with me. And I ended up seeing a naturopathic doctor who I still see to this day. And she supported me with optimizing my nutrition, starting herbal medicine, taking medicinal herbs, changing my exercise habits, and managing my stress response, and essentially doing everything that I could to support my thyroid health. Some symptoms improved immediately. It was during my 4th year, and if anyone knows the program, they know that it's a very intense program. So that was just enough to get me through board exams. And when I graduated, about a year later, I started my own practice, and I had more time to implement these changes, and my energy drastically improved. Um, since then, since I graduated, I've been working for the past 5 years with patients in my private practice, and I've really refined my approach to support those who have a similar experience. It was upsetting for me, actually, to see that I could have known about my thyroid condition when I was 13 years old. And I was really imagining how my life may have been different, or what it could have looked like when I started, if I had started treating it then, or if I had known that there was an imbalance at that time. So, other than my personal relationship to thyroid health, why do this workshop now? One of the reasons is the prevalence of subclinical hypothyroidism and thyroid conditions have been on the rise and continue to rise since the 1950s. And I will talk more about what subclinical hypothyroidism is. Another reason to do this talk is because of what I'm constantly seeing in my clinical practice. So fatigue, difficulty managing weight, hair loss, brain fog, changes in menstrual cycle, many of the things I personally experienced, and people don't have an answer to what is causing this and how they can feel better. Lastly, my colleagues and patients have been asking me to offer more condensed, concise information on thyroid health, so that's easily accessible. So here we are. As a naturopathic doctor, I was trained to motivate and educate patients so they can make informed decisions about their health and health care. So I'll give you a solid foundation today about thyroid health with a focus on hypothyroidism. And we'll go through the top 3 questions I get as a naturopathic doctor with a focus on hormonal health, specifically thyroid health, and we'll talk about key signs and symptoms. And then lastly, we'll talk about what you can do now, and I'll give you a bit of info on my favorite modality, which is herbal medicine. So the foundations of a healthy thyroid. So what is a thyroid? The thyroid is a gland, and like other glands, its job is to produce hormones. The thyroid specifically produces thyroid hormones. As you can see on this picture, it looks, it's located in the neck, and it looks like a butterfly with 2 lobes connected by an isthmus, what is called an isthmus. It's found below the larynx, so also known as your voice box, and specifically your laryngeal prominence, which is commonly known as your Adam's apple. So you can see that there, and it extends down towards your trachea or windpipe. The thyroid is actually part of a larger system called the endocrine system. And the endocrine system is made up of glands. And as we learned, glands produce hormones. As we just learned, glands produce hormones. And what are hormones? Hormones are messengers that tell our body what to do. So they communicate information from one end of the body to another throughout your blood. So what does the thyroid do? What's its role? The thyroid makes thyroid hormone. It makes mostly the thyroid hormone T4, and T4 is actually the storage form of the thyroid, which means it's not yet active. T4 is actually converted to T3 in your liver, and T3 goes into the cells and does its work. So T3 is considered the active hormone. And this is really important because here we can see two areas of potential imbalance. And I'll talk more about the different patterns of hypothyroidism, but we can see that you can have an imbalance when making T4, when the thyroid is making T4, and you can have an imbalance with conversion when the T4 is converted to T3. So when I'm looking at a lab, a full thyroid lab, I'm looking at T4 and I'm thinking, how much is being made? Is this adequate? And then when I'm looking at T3, I'm thinking, how much conversion is happening to this active thyroid hormone? Is this adequate? And this is why a good thyroid panel includes both T3 and T4. So how does your thyroid know how much hormone to make? And this is important because it can be a bit confusing, but I'll do my best to explain it well. So how does your thyroid know how much to make? So the function is regulated by your brain, more specifically, and you'll see it here, the pituitary gland. There's the anterior and posterior pituitary. And the anterior pituitary spits out a messenger hormone, which is TSH, thyroid stimulating hormone, to tell your thyroid to make thyroid hormone. So if there's not enough thyroid hormone in your blood, your brain will release more TSH. But if your levels are too high in the blood, your brain will make less TSH. So your body is always trying to remain in balance. Now, when we're thinking of an underactive thyroid, we can think about your thyroid as being asleep, or even think about when you're asleep. People are calling you, you're not picking up. People are calling you on the phone, and you don't want to pick up because you have to make T4, you have to make thyroid hormone. So your brain sees that more thyroid hormone needs to be made, and it's nudging your thyroid. It's nudging it to release more by releasing more and more TSH. But there's still not enough thyroid hormone in your blood. So the brain keeps releasing TSH, it keeps nudging it. And this is how we explain why high TSH is equivalent to a low functioning thyroid. Similarly, an over-functioning thyroid, you'll see a low TSH because your brain is trying to regulate the excess thyroid hormone in your blood. So essentially, TSH, as you see on the diagram, responds to T4 and T3 levels in your blood, and it's called a negative feedback loop. So on this slide, you'll see what the thyroid regulates. Thyroid hormones are found in every cell of the body. So what the thyroid does is so vast and essentially involves each system of the body. And most schools teach a very textbook presentation of hypothyroidism, or if you Google hypothyroidism, you'll get this very textbook presentation of someone being larger bodied, having constipation, low mood. but thyroid imbalance is much more variable from person to person. And even if you look at all the systems and functions that your thyroid regulates, you can imagine how this presentation can vary so much. So how do you know if your thyroid's not working optimally? Some of the symptoms that my patients have said and continue to say when they come in are that they have low energy. When they wake up in the morning, they feel tired. They might feel tired throughout the day. They have cold hands and feet. So brain fog, so difficulty concentrating or a foggy feeling, skin changes, hair thinning, drop in sex drive, low mood or anxiety, digestive issues. Typically, we think about constipation, but it could be anything. Um, Changes related to your cardiovascular system, so blood pressure and cholesterol changes, aches and pains, ringing in the ears, restless leg syndrome. So you can see that it is quite vast and variable, and can present in the non-textbook way as well as the textbook way. So what actually causes a thyroid imbalance? I really like this diagram because you see the different causes and you see the different areas in thyroid production that are impacted by these causes. I'm not going to go into this a lot today because it would take some time, but I'll mention that some of the potential causes are iodine intake, so lack of iodine intake or increase depending on which way, toxins, nutrient deficiencies, food sensitivities, and stealth infections. When it comes to Hashimoto's thyroiditis, which we'll talk more about, there's also a genetic component there. So it's important to mention that if you're speaking with a general practitioner about your thyroid. So I want to talk about why hypothyroidism is underdiagnosed and why you may still feel unwell even though your blood work is said to be normal. And the first and most important thing to talk about is testing. Most general practitioners tend to screen using TSH because it covers most people, and they don't test thyroid hormone. So they don't test T3 and T4, and they don't test your antibodies. But TSH is only one part of the picture. And again, I understand the reasoning behind it. It's cheaper on the system, and it will cover about 90% of people in terms of screening. But if you have these symptoms and your TSH lands within the range of 0.5 and 2, I do give my patients the option of doing a full panel. And especially when I think back of my own experience, I would have rather known what was happening with my thyroid when it was initially out of balance rather than waiting 16 years later. And I imagine that most people probably feel the same as well. The second reason is treatment. The only drug conventional medicine has to treat hypothyroidism at this time is levothyroxine, which is also known as Synthroid. And there's mixed research regarding whether it's actually useful in treating someone who has a TSH under 5. So it makes sense. Why would they test if they can't treat? I also use that approach in my practice. It's quite reasonable. The last reason I want to talk about is the range of TSH. The range with most labs regarding TSH is 0.5 to 5. And again, this range is fine for the general public, but it's not inclusive of everybody. And because what if you are that 10% who has subclinical hypothyroidism? And so if you remember my story, my range never went above 5, but I had symptoms, and eventually after many years it went into full-blown overt hypothyroidism. So this is why your diagnosis might be missed. So that's your foundation. That's your foundation of thyroid health. Um, I'll Now that you kind of have a pretty good understanding of what the thyroid does and how it functions optimally, I'll talk about the 3 questions I get in my practice from patients. So can I take this one? This is the one I get quite often. Can I take what my friend is taking for their thyroid condition? The short answer is no. Just because your friend has hypothyroidism and is taking something that helped them, it doesn't mean what they're taking will work for you. Why? Because there are more than 9 patterns of thyroid imbalance, and you'll see when I'm going to send out a handout after the talk, and you'll see that there will be, well, actually, it's right here. You'll see the 9 patterns of imbalance, and you can look at them more closely, but I'm going to talk about 3 of those today. So subclinical hypothyroidism. So this is one of the more common patterns I see. This is when your TSH is within normal range of under 5, and so is your T3 and T4, but you're still experiencing symptoms. So you have the symptoms, but you don't have the labs to back it up. And this occurs in 4 to 10% of the general population, so it's quite common. And sometimes it can lead to overt hypothyroidism, and sometimes it can lead to Hashimoto's thyroiditis. So it's important, other than the fact that you're experiencing symptoms, it's important to also treat it for this reason. So the second imbalance I want to mention is Hashimoto's thyroiditis. So Hashimoto's thyroiditis is an autoimmune condition, and it commonly affects women between the ages of 30 and 50. And this is a good time to talk about antibodies when it comes to thyroid health, because it's a big part of this picture. So the body produces antibodies as part of a normal response. So if there's something it perceives as foreign, like a virus or bacteria, it will produce antibodies. But when autoimmunity happens, like in Hashimoto's thyroiditis, it will produce them in response to the self. And in this case, it produces them in response to your thyroid gland. So how does this present? So 90% of the time you'll see elevated antibodies, and they will be high. So I'm talking like hundreds, sometimes thousands, and that's an important differentiating factor when it comes to the next pattern I'll talk about. Sometimes patients can have had elevated antibodies and may have been asymptomatic for 2 to 7 years before being diagnosed. So this is another reason why the screening, the TSH screening can be questioned. It's important to also mention that another pattern, the autoimmune condition that causes hyperthyroidism and overproduction of thyroid hormones, is called Graves' disease. And that's where with this condition, the negative feedback mechanism is not being regulated. And so the gland continues to be stimulated and grow, and you have an increase in thyroid hormones in your body. Lastly, I'll talk about selenium deficiency. So here you see the lab pattern of selenium deficiency. So selenium is a mineral, and it's important when it comes to thyroid production and function. And it's important also when it comes to the conversion of T4 to T3. So you'll see that the TSH is high, and the T3 is low because the conversion is not happening, and your body is wondering, why aren't there enough thyroid hormones in my blood? So it's nudging and nudging for you with the TSH to make thyroid hormones. So here's an example of when you may see someone with hypothyroidism who is on levothyroxine, but does not feel better because their nutrient deficiencies have not been addressed. All right, next question. I want to lose weight. How do I exercise if I might have hypothyroidism, and what foods should I eat? So I want to acknowledge here that there are a lot of complexities around exercise, including access, motivation, being shamed for not exercising, the connection to weight, and fat phobia. And often patients are told to exercise without discussing the barriers to do that. So I'm not going to go into this today, but I want to acknowledge that exercise can be more complex and it can take a lot to get to where you want to be when it comes to goals. So I'm not suggesting this lightly, but I do think that knowing how exercise can help with thyroid health may be an important motivating factor. So exercise helps with conversion of thyroid hormone from T4 to T3. And remember, T3 is the active form of thyroid hormone. And this is specifically aerobic exercise. So cycling, jogging, swimming, anything that increases your heart rate and breathing. And what you want to aim for here is 3 times a week for 15 to 30 minutes. And obviously, if needed, to start slow, because anything will be helpful. And this is why people feel better after exercising, or one of the reasons people feel better after exercising, especially if you have a thyroid condition. So let's talk about food. It's really important to consider food sensitivity, as I mentioned it earlier, as one of the causes, as it can be a compounding factor when it comes to hypothyroidism. I won't be able to get into it today, but I'll leave, because I want to leave you with some more practical tips of what foods to have and what foods to have less of. So foods to have if you suspect an unbalanced thyroid: foods high in iodine, so saltwater fish, iodized salt, some seaweeds, foods high in selenium, so Brazil nuts, animal foods including seaweed, foods high in zinc, so alfalfa sprouts, pumpkin and squash seeds, and iron, so animal foods, kale, quinoa, nettle tea, wheatgrass, seaweed again, and blackstrap molasses. The foods you want to avoid are consuming goitrogens in excess when they're raw. So this is from the brassica, foods from the brassica family. It's okay to lightly saute them. Soy diets, so when you're having excessive soy, so over 30 grams of soy a day, can reduce thyroid hormones. So you just want to not have as much soy if you are having that much. And then you also want to reduce pesticides. And a couple ways of doing that are looking at the environmental working groups, Clean 15 and Dirty Dozen fruits and vegetables, and they release that every year. Doing regular saunas so that you're sweating out toxins, and regular liver support can help with that as well. Third question: can herbs help me with my thyroid? Yes, they definitely can, but this goes back to the patterns and which ones you should use, when, and which forms you should take them in. So that is really the bigger question, is which ones should you use and which ones are appropriate for your pattern and condition. Most people will initially feel better taking herbs, because often the thyroid formulas have adaptogen adaptogenic and nervous system support herbs. So people, which is a big part of treating thyroid health. So, so they'll feel better initially, but unfortunately, most of the time, this doesn't get to the root cause. So I'll summarize what you can do today. So get comprehensive testing, and I'll include this in the handout, and that includes TSH, T3, T4, the antibodies, and this really gives you a sense of what your pattern is when it comes to thyroid imbalance. I always suggest this to my patients, which is to collect all of your previous testing from your doctors and compile them, and new testing as well, and create a personal medical file, either electronic or physical. And, that's how I actually found out about my, what I shared earlier about my thyroid story. I kept collecting my medical file, and then finally I decided to go through it, and I was able to understand, when my thyroid imbalance started. We talked about movement, so aim for aerobic exercise, 20 minutes, 3 times a week, but of course start where you can, and remember that it helps convert thyroid hormone. And eat more of the foods that support thyroid function, and I'll put that in the handout as well. So what's next? In addition to doing those things, if you want to work one-on-one, you can book a free 15-minute call to see if we'd be a good fit, and we could talk about your specific thyroid imbalance. I'm going to be launching a thyroid group program, and I'll send info on program details and eligibility criteria. And then if you're interested and meet the criteria, you could sign up. And you could also be referred by another ND if you're not a patient of mine already. And that's it. Thank you, everyone, for coming.
Thank you so much, Dr. Tania Tabar. So helpful. I just wanted to open it up to see if there are any questions from folks who got to watch. I found that super helpful, hearing about the specific things that people can do now. Also getting back into the physiology of how the thyroid hormone is produced. I think it can be really confusing to hear, oh, your levels are elevated in your TSH or your thyroid stimulating hormone, but my thyroid's not working. Like normally that wouldn't make a lot of sense, I think. So
Exactly.
Yeah, I'm glad you drew that out. That was, for me at least, really helpful. And then, folks, we are going to be sending out the recording from today. So if there's anything in detail that you wanted to go over, you'll be able to go over it, and we'll post it on our YouTube. Also, I think you said you had a handout that you're going to send out.
I do, yeah.
Yeah, so that's really exciting. We'll send that in the same email. Anyone have any questions right now? You can feel free to put it in the chart, in the chat, in the chat. And you can also email us separately. Dr. Tabar's email, can I give out your email?
Sure, yeah.
Is Tabar, TATB-AR at aurammedicine.ca. Also, you can follow her on Instagram at Dr. Tania Tabar. Okay, here we go. I've got a question. What are your thoughts on ashwagandha?
Ashwagandha is, thank you for your question. Ashwagandha is a great herb for thyroid support. I do use it quite a bit, quite often in when I'm creating thyroid formulas. It is known to help produce thyroid hormone and to therefore increase the levels. And it is also an adaptogen, so it helps regulate stress. So I do see some people really benefit from that herb. Again, it depends on what pattern we're looking at, and do we need to address another area of, I guess, of in a of kind of like error. So do we need to address like another discrepancy in the function? So it really depends if we need to address like antibodies or nutrient deficiencies, but generally I quite like ashwagandha, also known as withania, for thyroid support.
Yeah, that's really helpful. I mean, I use it a lot too. I find ashwagandha, there's a lot of reasons when not to take it. And so you kind of have to look out a little bit, especially if there's other hormone conditions, comorbidities. So we like to take individualized approaches. Dr. Tabar does that very well. So it's better to work with someone if you are going to be kind of self giving yourself some herbs. But I like to err on the side of caution.
Mm-hmm.
Yeah, I hope that answers your question, eh? G.A. Grant had another question. For folks with HT, do you usually
Hashimotos,
recommend using
thyroiditis.
Synthroid in combination with naturopathic approaches?
Yeah, I definitely do, because like I mentioned, Synthroid is only one part of the picture. So if someone is on Synthroid and they're still experiencing symptoms, it means that Synthroid is essentially T4. So if there's an issue with conversion, or if your antibodies aren't controlled or lessened, then we want to address those other areas. And so we might address them while you're on Synthroid, while monitoring your thyroid hormones.
Yeah, absolutely. And being under the care of a provider who is trained in the herbs will help you make sure there's no interactions. Okay, we have more questions. So this is a good question. Is the test the only way to tell? Can some of the symptoms be seasonal and still? So there's three questions here. So is the test the only way to tell, I guess, if you have hypothyroidism?
I'm gonna say yes. I'm gonna say gray area. It's the best way to tell and the only way to confirm. There are other approaches which include taking your temperature to tell, but again, you won't know. That might indicate an underactive thyroid, but you're not going to know which pattern you have. So so when it comes to testing, and Dr. Julie knows that in general I'm not a huge tester, but when it comes to the thyroid hormones, I like to test. It's one of the less expensive tests, and it can tell us a lot and save a lot of years of trial and error. So I mean, the answer is kind of like a yes and no, but I err on the side of caution, so I would say yes.
Yeah, I mean, I'm really glad you shared that. Yeah, because it's a hormone. I mean, it's very specific to test in the blood. It's a blood messenger, so it really is an accurate test.
Yeah.
Yeah, and there was a question about if there are skin changes. I don't know if you can speak to that. I see a lot of comorbidities in my practice. Is that something that you see?
It is, yeah. I see, I mean, skin dryness is one of them that I see. That's directly coordinated to thyroid imbalance, but Like you said, Dr. Julie, there are comorbidities like digestive issues, digestive infections. And then with that, often we'll see skin conditions because you're not eliminating or because there's an imbalance in your gut microbiome. So there is the direct connection and there is the comorbidity connection as well.
Great. I think that's, I hope that helps answer those questions. There's another question here. Are there ways to get off Synthroid gradually if you have Hashimoto's, or is one dependent on it for the rest of your life?
That's a good question. And I have to say, it's really variable. It depends on how long you've had it, how you respond to treatment. And it's possible. It's not, but it's really hard to say. It's really variable. It depends on the individual. And I can also answer the question of who said, is it possible to reverse subclinical thyroid hypothyroidism? That's usually easier to reverse because we're in the earlier stages. When we get into Hashimoto's thyroiditis, it's possible, but it really depends. And sometimes, in naturopathic medicine, it's hard to know what, it's a bit like there can be the art piece where we don't know what made someone, we don't always know why someone's was reversed and another person's wasn't. So Dr. Julie, do you have anything to add to that?
Yeah, I mean, that's exactly what I was thinking. It really depends. And it also kind of depends on how much folks are willing to do. I find the biggest limitation or the reason for the plateau is we want to do it all, but maybe life gets in the way. It's quite challenging because in order to reduce the antibodies, you have to reduce all the triggers for quite a long period of time, and then change the way that the immune system is differentiating, and so that the fewer antibodies persist. It's certainly possible, and I've seen some cases where it's reversed, and so I know that it's possible. It depends a little bit on compliance, the degree of genetic penetrance, the medication levels, things like that, and the willingness, I think. Yeah.
And Synthroid, in the realm of pharmaceuticals, is really just T4. So it's not going to have really intense side effects the way other medications would. So I'm more concerned about, are you feeling better, or are your symptoms improving, rather than weaning someone off Synthroid, and are we moving in the right direction? So so that's another kind of, I think, important factor when considering weaning medications.
Yeah. No, I love that. That's so important. I mean, when we often see a lot of comorbidities, right? So sometimes we'll see digestive concerns and have to treat the small intestinal bacterial overgrowth, which is blocking nutrient absorption. And so we're not getting those micronutrients that we need even to produce those, our own endogenous hormone or convert it. So sometimes those need to be treated first. And
Right.
sometimes like the resistance can, I completely agree. There was one more question about whether or not you talked about hyperthyroidism. Hyperthyroidism?
I barely talked about it.
Yeah. Is it one of the 9 patterns?
It is one of the 9 patterns. You'll see it in the handout. I mentioned it when I talked about Hashimoto's because I mentioned it in relation to Graves' disease, which is the autoimmune condition that causes hyperthyroidism. In terms of treatment, it's the similar principles. We're talking about herbs, we're talking about comorbidities, looking at infections, stealth infections, but we're essentially trying to do the opposite, which is reduce thyroid hormones, but we are there. Often it is caused by Graves' disease. So really, we're looking at the big autoimmune picture there, and how do we reduce that process?
Yeah, it's harder to talk about hyperthyroidism because oftentimes folks will get surgery too
Hmm.
as a treatment, and then they end up with a hypothyroid
Exactly.
picture. So we end up treating hypothyroidism a lot more. Is that your experience too?
Hmm.
Yeah,
Definitely.
yeah. Yes, and then there's another question if we'll be emailing the handout. So yes, to reiterate, we will be emailing the handout, a link to this video so you can review it on your own time. Also some other resources. We'll just put it all in there together. And yeah, we'll try to get that going to all folks who registered, even if you weren't able to join us today. Fantastic. So I think we got all the questions. If not, don't hesitate to reach out. I mean, we're available. And
Mhm.
Dr. Tabar is available for the free 15-minute consults. And that's always a great way to connect. I always like to say, just make sure your naturopathic doctor is a good fit for you, is going to be able to help you in the way that you want support. And yeah, Dr.
Exactly.
Tabar just added her email to the chat. So again, ttabar@aurammedicine.ca. So this has been great. Thank you all for coming. Thank you, Dr. Tabar, for sharing so much. It was concise and to the point, and just really, I think, it answers a lot of our questions, and a lot of my patients' questions too. So thanks so much for joining us, and we will see you at the next one. Or Medicine is having another couple talks, and we're always having talks, so follow us on Eventbrite too. All right, take care, everyone. Have a great day.